Good afternoon, everyone. I would like to introduce you to the Molar Bears and to our study, YouTube as a clinical learning tool. Our fearless leader and advisor was Dr. Keith Mays, DDS, MS, PhD, Associate Professor, Department of Restorative Sciences, and Interim Dean, University of Minnesota School of Dentistry. Our group of unbearably bright individuals consists of Dr. Lorel Burns, DDS, MS, Assistant Professor, Department of Endodontics, New York University College of Dentistry. Dr. Elham Abbassi, DDS, Clinical Assistant Professor, Department of General Practice and Dental Public Health, University of Texas Health Sciences Center at Houston. Dr. Sue Qian, DDS, MS, PhD, Department of Orthodontics, Tufts School of Dental Medicine. Dr. Anthony Mecham, DMD, Associate Professor, College of Dental Medicine, Roseman University of Health Sciences, and myself, Dr. Paul Simeteys, DDS, Assistant Professor and Team Leader Faculty, Western University of Health Sciences, College of Dental Medicine, Pomona, California. Our study, a Qualtrics survey, focused on third and fourth year dental students. Our goal was to assess the variations not just by institution, but also by level of learning. Each one of us obtained an exempt IRB approval from our respective institutions after we finalized our survey questions. The survey was disseminated on October 31st of last year and closed on Valentine's Day, February 15, 2020. There were a total of 479 student participants with a combined response rate of 28.3%. Individual institutional responses varied from 19 to 46%. Because the size of classes from different institutions varied greatly, the percentage of participants also varied. What you will see, however, from the data that Dr. Lorel Burns will present is that there were very little statistical differences from each institution. I believe this bodes well for the validity of our questions and the credibility of our study. Approximately 2/3 of the participants were from third-year students with no statistical difference from institution to institution. Questions of the survey were broken down into 4 categories: demographics, general YouTube use as a tool to learn clinical procedures, and YouTube video sharing and validity. Dr. Lorel Burns will now present the results of our study.
Thank you, Paul. So we're going to present some of the study highlights. So we started with demographics questions about the students, and you saw already which dental schools and how many students from each dental schools participated in the study. You'll also see here in this slide that the majority of our respondents were third-year dental students, and we found that third-year dental students were more responsive than fourth-year dental students at each institution. So we started off by gauging how long the students had been YouTube users in general, irrespective to dentistry. And we found that the majority of respondents visited YouTube daily or weekly, and that their primary use for YouTube was for entertainment. 74.3% primarily used YouTube for entertainment purposes. And so once we had a general understanding of how the students use YouTube and how familiar they are with YouTube, we started asking them about their YouTube use as it related to dentistry. We asked them if they found YouTube videos on clinical procedures to be a helpful learning tool. And we found that 95% of students did agree that YouTube videos were helpful to learn clinical procedures. Furthermore, we found that there was no statistically significant difference between dental schools or between third and fourth year students when it came to this response. So then we started asking them how they use YouTube videos as it relates to their clinical learning. And we asked them how likely they are to refer to a YouTube video to prepare for a clinical procedure that they had never done. And you can see here that 76.8% of respondents were likely to use YouTube to prepare for a clinical procedure that they had never done. And there was no statistically significant difference between dental school, and a Kruskal-Wallis test was used here for the statistical assessment. We then asked them about the frequency of YouTube use as a clinical learning tool slightly differently. We asked them to pick one of the following options: that they used YouTube always when they prepared for a clinical procedure, that they used YouTube only before their first time attempting a clinical procedure, that they rarely used YouTube, only when they needed a refresher on a procedure they had not done in a while, or that they never used YouTube to prepare for a clinical procedure. And you see here that there was a statistically significant difference between third and fourth year students. D3 students used YouTube videos more regularly than D4 students. We found that although most students in D3 and D4 only referred to YouTube videos before attempting a procedure on a patient for the first time, D3 students were more likely to use YouTube always when they prepared for any clinical procedure, as opposed to D4 students who were more likely to use YouTube rarely, only when they needed a refresher on a clinical procedure they hadn't done in a while. We furthermore asked which types of dental procedures the students used YouTube to prepare for. And we found that the average student used YouTube in 4.3 different clinical areas. And you can see the range of responses. We did not do a statistical analysis by institution here, but you can see that YouTube was used to learn a variety of different clinical procedures and disciplines. We then asked the students which of the following aspects of learning do they feel that YouTube videos are the most helpful with. And the two most prominent areas were concept understanding and visualization, and procedure technique. And for this, there was no statistically significant difference between dental school or between third and fourth year students' responses. After understanding how the students use YouTube as a learning tool, we wanted to ask them how they gauged the videos in terms of its evidence-based. So when asked if the students found YouTube videos as a tool for clinical learning to be evidence-based, we found that over 36% were unsure about the evidence base of the videos or did not find the videos to be evidence-based. We asked that question slightly differently as well. We asked them to what degree do they find YouTube videos as a tool for learning clinical procedures to be reflective of what they are taught in dental school. And these were the responses. Many found the videos only somewhat reflective of what they were taught in dental school, and quite a few were also unsure about how to assess that. And we found no statistically significant difference between dental institution when it came to this response. Now we asked students if their dental school faculty ever recommended YouTube for learning clinical procedures. And over 62% reported that their faculty had never recommended the use of YouTube for learning clinical procedures. We then asked if the students would like for their dental school to post tutorials on clinical procedures to YouTube or social media, and found that over 88% would like for their dental schools to post videos on clinical procedures to YouTube or social media, expressing a desire to make it a formal part of their dental school curriculum. So overall, we found that over 95% of students found YouTube videos to be helpful as a clinical learning tool to assess clinical procedures. And we found that D3 students were more likely to use YouTube frequently as a learning tool than D4 students. And this may just reflect a difference in their learning stage, where more clinical procedures are new to the third year students than the fourth year students. Additionally, we found that the overwhelming majority of dental students would like to see the use of YouTube videos as a clinical learning tool incorporated into their formal dental school curriculum. So we're happy to take any questions that you have, but we are confident in the generalizability of our findings, considering we found very little to no difference between results as it relates to dental institution. Thank you for your time.